Hi, I'm Dr. Antonio Meza Cortez. Welcome to this educational series on Autism Spectrum Disorder, also known as ASD. In this first video, we will take a look at what autism is, how it varies from person to person, and why identifying it early is so important. Let's get started. Let's begin by placing autism in a broader context. Autism falls under a category of conditions called neurodevelopmental disorders. These are caused by abnormal brain development, and they usually present in early childhood. They can affect a child's ability to think, communicate, behave, or move. Some examples of neurodevelopmental disorders include Autism Spectrum Disorder, intellectual disability, ADHD, language and speech disorders, learning disorders, and even schizophrenia. Now that we've seen where autism fits among neurodevelopmental disorders, let's take a closer look at how it presents and why it's called a spectrum. When I first came across the term autism spectrum disorder, I wondered, why is the word spectrum included in the name? The reason is that autism presents with a wide range of severity. Some individuals have only mild symptoms, while others are severely affected, and many fall somewhere in the middle. In the past, autism was divided into separate conditions based on the severity of impairments in communication and behavior. And these conditions include pervasive developmental disorder, which typically reflected mild autism, Asperger's syndrome, corresponding with moderate cases, and autistic disorder, which represented the most severe form of the condition. But with updated psychiatric guidelines, these individual labels are no longer used. Today, anyone who meets the diagnostic criteria for any of these previous presentations receives a unified diagnosis of autism spectrum disorder, a term that captures the full range of how autism can present in different individuals. Now, to better understand what this spectrum looks like, let me give you two examples. First, we have Carlos, who has severe autism. He was unable to develop language skills, and as a result, he cannot understand spoken, written, or read language. Therefore, he can't communicate effectively with others. Because of this, Carlos requires lifelong support and is completely dependent on others for his daily needs. On the other end of the spectrum, we have Juan, who has mild autism. He was able to learn language, allowing him to speak, read, and write fluently. He even earned a college degree and is able to maintain a job. However, Juan struggles in social situations. For example, he avoids making eye contact when speaking, and therefore people tend to think that he's a weird guy, and they avoid him. But despite these social challenges, Juan is independent and lives a functional life without needing supportive care. These two examples of Juan and Carlos show how the same condition, autism, can look completely different depending on the individual. And that's exactly what the term spectrum is meant to capture. As you can see, autism can look very different from one person to another. But regardless of where someone falls on the spectrum, there's something we know for sure. The earlier this condition is identified, the better the outcomes for the affected individual. One of the most important things to understand about autism is this: early intervention can change lives. This is because the brain is most adaptable during the first few years of development, a process known as neuroplasticity. Neuroplasticity allows the brain to form new neural pathways, even when normal development has been disrupted. And this is what makes early therapy so effective. They tap into the brain's natural ability to reorganize and acquire new skills. Therefore, when autism is diagnosed early, we give children the best chance to build communication, social, and cognitive skills, helping them reach their full functional potential. For instance, with early treatment, a child with severe autism might eventually gain enough independence to live on their own, rather than relying on lifelong care. And a child with mild autism might be able to graduate from university instead of just from high school. In some cases, children who are diagnosed early and receive the right support may even reach a point where they no longer meet the diagnostic criteria for autism spectrum disorder. On the other hand, when a child is diagnosed later, either in late childhood, adolescence, or even adulthood, and only then begins treatment, they do not benefit as significantly. This is because by that time, many of the neurons that supported neuroplasticity have already died off, and the brain is much less responsive to intervention. This is why early recognition matters so much, because the earlier we act, the more we can help. At this point, we've talked about the importance of early recognition, but what exactly are the signs we should be looking for? Let's go over the key features of autism and how it typically manifests. The core features of autism involve impairments in two major categories. On the one hand, deficits in communication and social interaction, and on the other hand, abnormal behaviors. Let's start with communication and social interaction. Deficits in this area include: first, impairments in social-emotional reciprocity, meaning the person may struggle to take turns in a conversation or respond to others in a way that makes interaction enjoyable for both people. Second, deficits in non-verbal communication, such as avoiding making eye contact or misinterpreting facial expressions. And third, the presence of difficulties forming and maintaining relationships, whether with peers, caregivers, or teachers. Now let's look at the behavioral abnormalities. These include: first, the presence of repetitive movements that lack an apparent purpose, known as stereotype behaviors. Second, a strong insistence on sameness, where even small changes in routine can cause severe distress. Third, restricted or highly focused interests, sometimes even on unusual topics such as the weather. And finally, atypical responses to sensory stimuli, such as overreacting to certain sounds or showing little response to touch or pain. Each of these features can vary in intensity from person to person. In the upcoming videos, we'll explore each of these manifestations in more detail, one by one.